This session's topic is determinants of health. Unlike the information in the other sessions, this information may save your life if you act on it. That's the nature of determinants of health. Just to narrow or to frame our discussion, what we'll be talking about is determinants of health in the United States in 2015. A century ago, this conversation would have been different because there were different determinants of health operating in the United States in 1915 than there are today. If we were talking about a different country, this conversation might very well be different, but we're not. So just to frame it, determinants of health in the United States, 2015. Could save your life. So we're going to review definition of health, some determinants of health in populations in the United States currently, and implications of that, and point out some additional resources you may be interested in. I don't know if folks are familiar with this. This is from the World Health Organization, and this is how they define health. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Have people encountered that definition before? Okay, some folks. So it's not just not diseased. It can be, health can be impacted by anything that impinges upon us, physically, mentally, socially. This, by the way, is, they established this in the 1940s, this definition. We still don't measure it, not in a real sense. What do we measure instead? Disease, mortality, you know, we can go, a lot of the measurement you can do in a graveyard, right? What's that?
We can't measure prevention.
And prevention prevents disease. And they say disease is not the only thing we're working on.
Holistic.
What's that? A holistic, yeah. So this is very aspirational. And even if you narrow the conversation to disease, we still don't, there's a lot of things we don't measure. The impact, the variable impact the disease has, for example. But they say that ain't good. Even if we're able to do that, that wouldn't be good enough because it's well-being that we're after here, okay? So, and we'll just deal with it. It's been, more than 50 years. They haven't figured it out, but we know that there's a gap. What we're really after is that sense of holistic well-being, and we're not there. Okay, so why bother with this? HealthInsight, health is right there. We better know what it means. And some sense of what produces health. So we need to understand that, and for our own sake, and for the healthy workforce. Okay, here are the usual suspects. Here are the things that are proposed that impinge on health. This is simplified, and it's not exhaustive. One could name others, but generally, when we talk about what are the determinants of health, these sorts of things come up. Okay? Another activity, it's right over there. You get to vote. You got 10 points total. You can distribute those 10 points between behavior, social circumstances, environmental, physical influences, medical care, and genetics. Grab a marker, make your votes. 10 points total, yes. Well, what are you seeing there? Again, review. What's that?
Seems to be even, right around even on each one.
It does look like the relatively similar contribution for each of those is proposed. Is that right? Looks like there's genetics. I'm seeing some dots pushing out that way. behavior a little bit on environmental and physical. Let's apply the test you proposed. Anything up here, and this is a reasonable test. This is when one does root cause analysis. One of the tests you apply is this something within our control? Now, remember that we have a board that has charged us with making a difference in health in our community, right? So we got to start cooking up our excuses for, for stuff that is beyond our control. What on there looks like it's beyond our control? Genetics certainly look like, although, you know what's funny is the line between genetics and medical care keeps moving. They keep finding solutions to things that didn't have solutions 10 years ago, but it's a darn slow movement. Don't hold your breath.
Even the line between behavior and genetics is also...
Behavior and genetics may be linked. They may be separable. It's worth asking, isn't it? Yeah. What else? Environment, physical influences? Is that it can always move. Go ahead.
It also depends about, the time that if we do this like 10 years in the future, it will be totally different. Like if we have done this before in the past, because everything changes. Environmental, before it didn't have an influence as opposed to now that is, what we are living now with everything.
Okay.
So, I believe that all of this, yes, again, it comes from your perspective.
And it is, and keeping in mind that this type of thinking is population-based. For an individual, for a particular individual, any one of these things in any moment and circumstances may dominate and in fact determine their health. You still do have to, we don't have it up there, but I suppose we have it up there in a way. You still have to look both ways before you cross the street. That's a particular behavior that matters a lot. It's just in the bigger picture, better put out the cigarette before you start crossing the street as well. Let's take a look at, so again, we're charged with this. This is part of what we're after. We think, actually, I'm seeing that we don't have a lot of confidence that medical care alone would tip the scales, would if you will, solve that problem. There's other things we have to consider. I went through and in your handouts, there's some constantly reviews on this topic. These, by the way, I got my public health degree a little more than 20 years ago, and these findings were from a paper published this year, almost exactly what they taught me 20 years ago. It didn't change very much, their assessment of. And so what are we looking at? That behavior is the dominant one. Now, folks will reasonably tie that behavior to social circumstances in many instances. Genetics is noteworthy, but it looks like in a population, most folks have an opportunity to have a positive influence on their behavior, on their health through behavior. Okay. We go a little bit deeper on behavior. So we apply the test. What are the types of things that we can influence? And the quality of medical care is something we're seeking to influence every day through our funded work. But we know if we're again way back over here, if this is one of the outcomes we care about, and the board tells us we care about it, right? And we're saying, guess what? We're working all day long on improving healthcare quality, and we do. Yikes! That's not going to get us there. We need to explore this, other causes, and now we've gotten some sense of our perception of what those other causes are, and now we've gone to the library, and here's some validation of this, or maybe some indication that we've maybe underestimated the impact of behavior and maybe overestimated some of the other things. So we might be able to become better calibrated. Actually, this is very much what we talked about before, when we've got variation here in our understanding of how do we resolve that. Well, one way, we can get some data and we can decide whether it's useful. So this is what we've done. We've gone to the library, or actually somebody went to the library for us, published this, and here's what we see. So given that behavior thing is such a dominant driver here, our understanding, so what does that really entail? So that itself could be a long list that includes look both ways before you cross the street. You won't find look both ways before you cross the street on this list. What do we find instead? Here are our usual suspects. Big one, but if we dodge that bullet of smoking, and I gave up, congratulate me, it's been 18 years ago, I gave up chewing tobacco. It's an awful habit. What's left? Physical activity is the next thing on the list. If it were medicine, if it were a prescription drug, it would be the most widely prescribed prescription drug in the world. There's nothing that approaches it. It's beyond the effects of, what's the most effective drug you know of, you've ever heard of? Insulin, right? Or it depends on the patient, certainly. But in a population, there's nothing anywhere close to that. In the United States, in 2015, in terms of determining population health. There's an interesting thing I want to spend a little bit of time with you to describe. There's if we go back here, social circumstances may be, okay, if we look at our assessment and even this assessment, this is a simplified model. Lots of research points to a relationship between social circumstances and behavior. Go ahead.
I just have a question about what social economical group did they look at to come up with this chart?
Population. This is the United States current.
Covers everything.
Babies to, throughout the United States. Yeah. But why would that matter? Go ahead. I mean, there's a reason that you highlighted that. You're just curious, or?
No, because we all know that those individuals that have less money have less access to good food, less access to the medical field, and their cultural influences also drive their opinion about health, what you need to do. I mean, it's so complicated.
Go ahead.
If we do an assessment of social circumstances, if you go just driving around to under, those areas, everybody knows what I'm talking about.
Yes.
Yes, and you could see them there. I mean, there are no parks, no access to nothing. And what do you find? Do you find just only the liquor store and places? Social circumstances, behavior, all of that.
And yet, in those areas, in those circumstances, do we find any healthy people?
Yes.
And in other circumstances, do we find unhealthy people?
Yes.
So, is there no hope?
Otherwise, we wouldn't be here.
Right. There's an interesting, and I'll spend a couple minutes on. There's an interesting observation about this. It's deprivation. It's a deprivation theory. There's a certain level of wealth, access to resource that is really deprived. It really doesn't support healthy life. And that's at the level of like abject deprivation. But there's a much wider range of socioeconomic circumstances. Poverty, go ahead.
This is just the only comment.
Okay.
I'm an MRC, a medical reserve corps, and I volunteer on weekends, and I go to different areas that really they need the most.
Mm-hmm.
And the reason that I go there is because I see the hope.
Okay.
Hope and making a difference in
Okay.
changing. I see people come in with 500, 600 capillary blood sugar. I see blood pressures 200, over 100.
Okay.
I just like, you have to send them out. You have to call the ambulance to take them.
Yes.
But I see hope, and that's the
Okay.
reason I do it.
Okay.
Because there is, it's fulfilling and you're making a difference. Your health is bad, and especially the children. You know you're going to be making a difference.
Okay. Very good. Thank you. Let me, I'll come back as well. There's a level of need that whereby really health is unlikely, very unlikely to be achieved. They're just the resources required for that are not available. And there's a much larger range of need or deprivation whereby health is nevertheless impacted. There's a gradient where one can demonstrate that people like living near the poverty level that have a roof over their heads, for example, that have access to the basic resources that required to sustain life. Nevertheless, in a population, those folks will suffer poorer health over the course of their lifetime than people in other circumstances. And there's the theory on how that works, the deprivation theory, is that these circumstances operate through chronic stress. That wears you down over a lifetime. Okay? So, so this is the way that this has been established. The findings are, it's kind of interesting, is that this gradient, if you will, between, I'll say, socioeconomic status and health operates over kind of a long, well beyond where poverty, abject poverty is there, and you can still see a difference between these folks and those folks. And it's a curious thing because you can demonstrate that these folks have access to medicine, they have access to food, they have the sorts of things, and you can say, when we profile the way this operates as two pathways, the behaviors, but that doesn't quite explain it. We need to explain it one other way, or that didn't get to everything, and then it's stress. And there's an interesting outcome there that is emerging, at least it's available to us, is that, well, let's see, I'm going to go with another. It's this idea that there are stressors in the environment, but only if, or at least it's partially dependent on our interpretation. That is, you don't have to experience stress from most of this. It is our interpretation that causes chronic stress. Does that seem plausible?
Absolutely.
Implausible?
No, it's absolutely true. That's it.
Okay. So that this is, okay. And the reason that this comes up is, so if these are root causes, and we say social circumstances are a substantial root cause. They're associated with stress directly, and they may influence behaviors as well. then what are the what can we operate on? What can we seek to influence? Well, I got my public health degree 20 years ago, and they told me that if we're going to make any difference, then we have to change circumstances. We have to change circumstances. This model suggests that, well, keep working on that. Keep working on that. I haven't seen a lot of progress in redistributing wealth in the United States in the last 20 years. This idea says that there's another pathway as well. People can learn to experience less stress in such environments. So if you're interested, actually there's some new, really interesting study. In fact, we're expanding upon that for folks. How many folks came to the Megaland in October? Lots of people did. Okay. So you heard about the 3 good things exercise that we employed there, right? The 3 good things exercise was based on this type of theory. It was on workplace burnout, was the thing that it was focused on, right? And it proposed that you could change staff's response to their environment and not without changing their environment. That people could learn to, through gratitude exercises, learn to experience less stress, less burnout, just by changing their interpretation, not by changing the circumstances. It's a promising new field. Like I said, they didn't teach me about it 20 years ago. Please.
Do we have time for me to give an example of that?
Of which?
The changing your interpretation.
I will. It'll be a brief example for the folks that weren't at the. 3 good things exercise. The folks that weren't at the Megaland is nothing more than this. It is for 3 weeks. You keep a daily journal, and it's recommended you do it in the evening. And what you do is at the end of the day, close to the end of the day, you write down 3 things that happened to you that day that you're grateful for. The theory behind it, and that has been demonstrated, and our colleagues at Duke have demonstrated, that reduces burnout in people working in clinical settings. The theory behind it is that, for one, the exercise itself makes you appreciate more the good things that happened to you that day. That's one driver. The second driver is it makes you focus your attention, or helps you focus your attention the next day on, well, I got to write down 3 good things. I better be watching for them. And just by shifting where your attention is, impacts stress. This has been substantially demonstrated on mild depression. Well, on depression, that one exercise alone performs better than Prozac on treating depression. So, and we'll get you some more information. Folks, how many folks tried that exercise? Really?
I call it a gratitude journal.
Sure. Okay.
I do it in my personal life and also for my clients, especially the younger population with depression. So one of the assignments that you must bring back to me after 30 days is a list of your gratitude journal. And I give them examples. It could be that you look at yourself in the mirror and you look pretty. I love my lips. I love my face. Things like that. Yes. And you actually physically see the difference in them after a few months.
Okay. Go ahead.
I've used this as a nurse.
Yes.
With astounding results. I had a patient that I was working in St. George, and a surgeon had come from Vegas to do back surgery on this gal, and it didn't go well. And she had a drain tunneled from her belly to her back, and she hadn't been out of bed for 3 weeks. Even to use the bathroom, had not been out of bed. I went in that morning, and she was furious for 45 minutes, talking about the doctor, how angry she was, that she deserved for him to come see her. And I finally said to her, "You're right, you do, but the truth is he isn't going to come. So you need to make a decision. Do you want to lay in this bed and die? Because you will if you continue this route. Or do you want to get well and move on with your life and be happy?" She said, "Well, no, I don't want to die." So I said, "We're going to play my positive word game. Every time I come in the room, I give you a positive word. You give me one back," and we wrote it on a board. By noon, she had gotten up out of bed and had walked into the bathroom with physical therapy. By the afternoon, she had walked around the bed. The next day, she was walking down the hall, and the third day, she went to rehab. And the only thing that we did differently was this.
Okay. All right. So this was a trick question. Look at this list. Does what we're talking about right now, does that influence health? Remember our definition of health. Where is it on this list?
Behavior.
Behavior, I will tell you the technical definition of behavior is something you can observe. Okay? Observe. If you can look at somebody and watch them can you tell somebody's being grateful by looking at them? Then it's not a behavior. I know, it's a trick question, I'm sorry. It is. It ain't on this list. Most of the thinking, most of the dominant thinking in public health doesn't recognize these sorts of influences. The explanatory style, that sort of thing. So this is a little bit on the fringe. So this is a little bit on the fringe, but really, if we care about this, then it's not good enough just to say the surgery went well, right? But the patient's miserable. Okay? So anyhow, yeah, keep that in mind. That I believe that has a legitimate place in our thinking and is a powerful, I'd rank it only second to physical activity. This sort of thing. So, we got to move on. So anyhow, this is what we were talking about. Responses to stressors, explanatory style, positive outlook, meaningful engagement and activity, those kinds of things also influence health. Probably to a greater degree than much of what we can find over there on the board, and probably can overcome a wide range of social circumstances that are otherwise not that supportive. Okay, so there's our determinants of health. You see how that starts linking into systems thinking? I mean, we're talking about causes, that sort of thing. So what about the triple aim? A couple things. So if we want to get to this, we've started exploring the types of things that are going to get us there. If I haven't said physical activity enough yet, note it. But here's the world we're working in. Accountable care. So this is a dominant movement in the United States. This is the biggest news in the United States. Healthcare, systems improvement. This is what's going on. It's just getting bigger and bigger. This is an alternative payment model. And it proposes that your doctor or some organization that they become part of is going to be made partially accountable for your healthcare costs. That's what accountable care is doing. Does that oversimplify it, Jerry? Does that get to?
No, I think it's ownership of managing or reducing the risk. Okay. So both the patient and the provider have to engage. That's why it's partially. Right. Because in the prior description, we were talking about engagement or ownership by the patient of I can choose to keep waiting for the doctor to come, or I can choose to take care of my own life. It's the same thing that relates to here. You need someone that's going to be your partner at moving forward, but both have to be working, firing on all cylinders. Okay.
So we're moving into a world where your doctor, or in fact, we're trying to promote, HealthInsight is trying to promote the move into this world where the doctor or organization they're part of is made partially accountable for the healthcare costs. way over there, healthcare costs too high. We've already traced it back and we said, where does that cost, where does that come from? Well, the dominant course is poor health, avoidable disease. We've expanded on this idea of other causes. And we've come out there. Where are those other causes? Behavior. Social circumstances, maybe. But keep in mind this idea of interpretation. So there is some ability to influence that. But at the end of the day, your doctor, your accountable or the accountable care organization that they're going to be part of is going to be financially viable or not by their ability to influence, positively influence behaviors. Go ahead.
The United States still has one of the healthcare costs in the whole world. You look at other countries.
Oh, yes, yes.
But see, that's the key, because they have like promoters of health. So it's not just on your physician, but it's a team. Everybody works together. And we are losing the battle. Because if you look at other countries, I mean, underdeveloped countries, their healthcare system is actually, rates are much higher.
So how are they going to, so you're highlighting the question we're headed toward here. How are they going to win this? How are they going to be successful under this new model? And it is mechanisms, we know by this review, it's mechanisms that influence patient behaviors or potentially their interpretation or the way they experience stress, that sort of thing. So applications, we're going to come to that. So we'll be expanding upon this. This information might save your life or improve your health if you act upon it. I believe so I put it on the slide. I myself participated in the gratitude journal exercising. I believe it's good for me. One of the reasons that I acted upon it. There are other behaviors, as we highlighted them, that are important. So, and this is our challenge. So healthcare providers are going to be there. They haven't needed to be in this game before. Their success didn't depend on helping patients change, adopt healthier behaviors. And that's changing. So that's the world we're working in. That's where our ENDS policies are driving us to. So non-medical drivers to promote health may be required. These are in your notes, and we can, if you're curious about more on the study of where the influences of health came from, there's some resources there. I'm going to post these on the eNet as well. I haven't done so yet, so those will be available.